Good morning. My name is Christine, and I am here to demonstrate the proper technique that we are using here at Baltimore Washington Medical Center to don and doff our PPE to prepare for any patients that we may receive that may be infected with the COVID-19 virus. We have circulating all three units in the maternal child health service line, which is labor and delivery, mom, baby, and the special care nursery. Techniques to don and doff in case that you forget or you weren't clear on something, or you can rewatch this video a few times. To make sure that we are doing this properly to not only standardize our procedure, but to make sure that we keep our patients and ourselves as safe as possible. The equipment that we'll be using will be the yellow gowns, which are located not only in the COVID-19 cart that will be prepared for each unit, but also in the linen room in the PACU area on labor and delivery. We will be using gloves, whichever size fits you. We will be using bouffant caps, which can also be located in the recovery area, linen room on labor and delivery. And we will be using eye protection. We do offer various forms of eye protection. The first form is the shield. As you see, it has a band, a stretchy band, and it has some sponges that will line your forehead. This eye protection is great for people that wear glasses. As you can see, I'm wearing glasses, so I'm going to put this on. And it offers a lot of face coverage, not only in the front, but also on the sides. This form of eye protection, this is called the shield, or splash shield, offers more protection than any of the other eye options that we have. Please know that if you are a eyeglass wearer, that does not count as eye protection. You must have an additional form of eye protection on you in addition to your eyeglasses. So these do not touch my glasses. My glasses aren't being smushed in my face. I can wiggle my nose, I can move around, and it's not interfering at all with my eyeglasses. The second form of eye protection that we have, I do not recommend if you wear glasses because they are another pair of glasses, and they're a little tricky to put on. I mean, you can get them on, but they kind of smush your glasses into your face and make it a little uncomfortable for my nose, and my eyelashes are kind of hitting the lenses of my glasses. So I would take my glasses off if I was a person that did not wear glasses, and I would put these on. Again, your glasses do not serve as proper eye protection, so you must wear some sort of additional eye protection if you wear eyeglasses. These glasses do not offer as much coverage on the sides or down below, but they are a little bit more comfortable. They kind of don't get in the way. They're easy. They don't move around. They don't slide down your nose. They do not come assembled, however. So in the labor and delivery PACU linen room, which is where these are kept, you're not going to find them assembled like this on the shelf. You're going to find them in a bag like this. So they'll need to be assembled. They come in two pieces. The first piece is the frame, so it's just a black frame with 4 nubs, and then you have the visor, or the eyepiece. So there is a brand or a logo and a dark green stripe. This is the outside of your glasses, and you're just going to pop those 4 studs through the holes of the eye shield to make a pair of glasses. Okay, so how you're going to find them on the shelf is going to be in pieces in a bag that looks like this. Our third option for eye protection is going to be this face mask. Now, that being said, this face mask is not an N95, so you will have to wear this mask over top of your N95 respirator. It does supply a face shield, but remember, you're going to have your N95 mask underneath of a surgical mask. So while you have your N95 on, you're going to have to put this on and tie both ties in the back of your head. So you're going to have a lot of material going on here. So it's going to get really hot really quick. This would not be my recommendation of eyewear because of the double mask issue. However, if you happen to go into the cart and there are no splash shields and there are no glasses, or we've run out and you're desperate for something, that is an option. But please remember, you must have your N95 mask on underneath of this shield if this is what you choose to use. Now we're going to don our equipment. The first piece of equipment that we're going to put on is going to be our yellow gown. As you put your hands through the sleeves, please be sure to place your thumbs through the holes that are in the wrist. This will help to keep your sleeves inside of your gloves when you put your gloves on, to prevent any exposed skin between your gloves and the sleeve of your gown. It will also help to prevent contamination of yourself when you doff your equipment. I'm going to put my gown over my head. So, my gown is on, however, I am not compliant. My gown is very flowy. If I move or I turn, I have a lot of flappage in my gown, so it can be contaminated. If it gets contaminated, it can then touch something else, or it's going to touch me, or it's going to touch another person and contaminate that person. Your gown is not properly on unless it is tied in the back. So I'm going to tie my gown in the back. Doesn't have to be super tight, just a regular bow. And as you can see, now that my gown is tied, I have a lot less flowing or flappage with my gown as I turn to do whatever I need to do in the patient's room, which is going to mean I am less contaminated and I am going to contaminate less in the room. So the next piece of equipment that we are going to don is going to be our N95 respirator mask. All staff is annually fitted to make sure that we are wearing the proper size mask to provide maximum protection from any airborne particles. So please make sure that you are using the proper size mask that you have been fitted for. If you are a small, on the front of the mask it will say 1860S. Please make sure that S is there. If you were sized as a regular, it will be 1860 and then nothing following it. That means that's a size regular. If you are a large, they're actually white in color. They're not blue. And then we also offer the duckbill shaped mask if you did not pass the fit test in this shape of an N95. So please make sure that you have the proper style and size of N95 that you've been fitted for through the hospital. As instructed, when we got fitted for our N95s, we're going to put our N95 up to our face and we are going to bring the bottom string over our head first. So bottom string over our head, and then we're going to bring our top string over our head. And then I'm going to pinch my nose to ensure that I have the proper seal to provide maximum protection against any airborne particles. As you can see, the straps of my N95 mask are not crisscrossed. This is the proper way to have your mask on. The straps should not be crisscrossed in any way. After you put your N95 respirator mask on, you're then going to don your eye protection. Today I'm going to choose to use the face shield. So I'm just going to stretch the band and place it around my head so that it is comfortable. And as you can see, It fits over my N95 mask. There's no competition for space. I can even put my hand through there. There's plenty of space there. I can still see. It's not bothering my glasses. Feeling protected. The final thing, or the next thing that you're going to don is going to be your hat. As we are taught to wear our bouffant hats in the OR, please make sure that your ears and your earrings are included or covered by your hat. And I'm going to pull the hat down to meet the sponges inside my face mask, making sure that all of my hair is inside so that it does not get contaminated by any air particles. I'm going to don a pair of gloves. Since I put my thumb through the hole in my gown, it will ensure that when I place my gloves on, that my gown is safely tucked up in my glove. It doesn't crinkle, it's not uncomfortable, it's slid in nicely. My gown is up to here, if you can't see in the video, goes around my thumb, so I have lots of protection and no space between my glove and my gown that could get contaminated. And I'm going to do the same with my other glove. So now I am ready to enter my patient's room. I have entered my patient's room and I have provided the nursing care that I needed to do at that time. So now I'm going to doff or take off my PPE and prepare to exit the patient's room. The first thing that I'm going to do is I'm going to do hand hygiene with my gloves on. I'm going to walk over to the sink in the patient's room. Every room has a sink. And I'm going to wash my hands with my gloves on. After I'm done providing hand hygiene, I'm going to grab the front of my gown, right where the strap is, and I'm going to gently but slightly aggressively pop the back of the gown open. I'm going to slide it off my shoulders and I'm going to start to roll so that the outside of my gown winds up inside of the roll. And I'm going to keep rolling until I get a nice ball of yellow gown and nothing but my gloves on. This is another reason why it's important to put your thumb through the hole of the gown, the hole that's in the sleeve of the gown, because it's now holding the gown inside my glove, which will prevent contamination as I'm taking off the PPE that I've worn in the patient's room. I'm going to take my thumb of my hand, I'm going to slide it under my glove, and I'm going to pull off the gown and the glove, which turns the glove inside out, keeping anything that's still contaminated on the inside. I'm now going to use my second thumb to do the same with the other hand. And again, my glove is turned inside out. The outside of the gown is inside of the ball. Everything that is outside of this ball should be the inside of the gown. I'm going to throw this into a red bag trash can that is in my patient's room. Whenever you take off a piece of contaminated equipment, you always follow up with hand hygiene. I've now removed my gown and my gloves, so now I'm going to provide hand hygiene. As you doff, every time you take off a piece of equipment, you perform hand hygiene. Removed my gown and gloves, perform hand hygiene. I am now ready to exit the patient's room. I'm going to step out of my patient's room. There's going to be another trash can with a red bag. I'm going to grab my hat from the back and pull it forward. Always remove things from the back and pull them forward because there's more chance of the front of you being contaminated than the back of you. The hat, as you can see, is not only protecting my hair, but it is also protecting the band of the eye mask that I'm wearing. So I'm going to grab the back of my hat, I'm going to pull it forward, and I'm going to deposit it in the red bag trash can that is going to be located just outside of the patient's room. Since I've removed the piece of PPE, I am now again going to perform hand hygiene. The next thing I'm going to remove is going to be my eyewear. I'm going to grab from the back, pull it forward, and dispose of it into a red bag trash can. Again, I'm going to perform hand hygiene because I've removed a piece of PPE. The last thing that I have to remove is my N95. I'm going to grab the bottom strap, find it, and pull that forward, not touching my face. I'm then going to pull the top strap, pull it forward, and dispose of the mask into the red bag trash can. I have now removed all of my PPE, and I am going to finish up with proper hand hygiene.